Hi, I'm Dr. John Shim, and today I want to talk about why you need to see a neurologist. As a spinal specialist and with my surgical experience, I'm often asked to evaluate people and make determinations for surgery. Most of the time, the answer is you may not need surgery at this time. To me, this should be a great relief for most folks. As an orthopedic spine surgeon and specialist, surgery is usually necessary when there's a significant risk for your life or an important bodily function. Thank goodness those situations are rare. In fact, if you have time to watch this video, I hope it is because while you have pain, you are not experiencing such a life or bodily functioning threatening issue. If you are, stop watching this video and go to the emergency room and contact your physician right away. Let's get back to the discussion about why you may need to see a neurologist. Spine surgery can be helpful for others with more chronic conditions as long as all the options have been explored and other potential causes of your complaints are investigated. Spine specialists often will come to a conclusion that surgery may not be beneficial for a certain person. The patterns of pain, numbness, or intermittent weakness may not be totally consistent with a spine source. A spine specialist may refer you to a neurologist, who is a type of physician expert in diagnosing conditions that may mimic a surgical problem. To give an example, people with diabetes may have numbness, tingling, and pain to the arms and legs. For diabetics, the reason may be that their high blood sugar levels have now caused changes to the nerves throughout the body. These nerve changes can cause similar symptoms, but not exactly the same symptoms as those of a significant pinched nerve to their spine. A neurologist with different tools like nerve conduction studies, further diagnostic testing of the brain and the spinal cord, and physical exam testing can determine if the complaints are related to something else, such as diabetes. The neurologist will use their expertise of physical examination to explore the possibilities of other entities causing your spine conditions. While going to a neurologist may seem intimidating, in reality, finding your diagnosis is very important, while also exploring the possibility of surgical management. Frankly speaking, unfortunately, I have seen patients who had complaints that did not completely match a spine source of pain or nerve findings who did not follow my advice to obtain further evaluation or examination by a non-surgical specialist like a neurologist. Unfortunately, due to desperation of pain, they pursue other surgical options instead and had surgery. I can tell you that surgical treatments for conditions that will not improve with surgical management is a really bad outcome. When a surgeon recommends further workup by a non-surgical specialist, I strongly recommend patients to follow through with that evaluation. I know many of you are frustrated with the pain and the chronicity of the condition. I understand you will always be able to find a surgeon who will take the risk of doing surgery for you. But without a limb or life-threatening condition, it may be more prudent to pursue further evaluations before making a surgical discussion. I'm Dr. John Shim. As I always say, I'm not trying to tell you what to do. At the same time, as an orthopedic spinal specialist and my experience of thousands of operations, I urge you to listen to your surgeon if there's a recommendation for further non-surgical workup. Thank you for taking the time to watch this video. I hope you will find a solution for your current complaints.